Okay, so today is our first session. Today we are going to have an orientation session about the course. So before starting with an orientation, let me introduce you to myself. So my name is Ruchika Sharan. I am the lead trainer and co-founder of Om Yoga International. So I welcome all of you to Om Yoga International for this beautiful course of 85 hours prenatal and postnatal yoga teacher training course. This course is registered from Yoga Alliance USA, as you all know. I hope all of you are familiar with Yoga Alliance USA. Yes? Okay. So
Yes.
Yoga Alliance USA is an internationally certified organization and it is located in Virginia in USA. Okay, so they have various standards about the yoga training courses 200 hours, 300 hours, 500 hours, and additionally, they have prenatal and kids yoga training course also. So, out of those, we are going to talk about our 85 hours. So, why 85 hours? Because this is a standard set by them. Okay, so that is why we are saying 85 hours. Like we have 200 hours, 300 hours. So why? Because these are the standards set by them. Okay. So similarly for kids yoga as well as pregnancy yoga also Yoga Alliance has set 85 hours. Okay. So these 85 hours we are going to cover in 1 month. Okay. So as you know, we are starting the course from today, 1st of May, and we will finish the course by 30th of May. Okay, see, normally we finish on time only, but sometimes depending on the batch, if there are more questions, okay, or the time goes on the discussion, so sometimes the course can extend 1 to 2 days more. Okay, but we always try to finish on time only. Let's see how it goes in this batch. Because we don't want to hurry in the course. Okay, so our main focus is always to impart the quality. Okay, so just hurrying up and lowering the quality of the course, this is not what we want. Okay, so even if we have to keep 1 or 2 classes extra, maintaining the quality of the course, we are going to do that. So I request all of you to keep 1 or 2 days flexible. Fine. So now, as you know, the course is of 85 hours. Okay, so you all must have studied the PDF which was shared with you. These 85 hours will be completed in two parts. One is 55 hours plus 30 hours. So 55 hours we are going to have live sessions. What is the meaning of live sessions? So face to face we are going to have the 55 hours. Okay, and other 30 hours will be the self paced learning. So what you are going to do in the self paced learning, of course whatever classes are going on, we are going to share the recordings of these classes so you can revise them at your own end. Okay, especially when we talk about the anatomy. Okay, see, pregnancy course is more about anatomy than philosophy. Okay, of course, you are going to study philosophy in this, but pregnancy is more about studying the anatomy of our body. Okay, and those of you who are already into yoga and have studied anatomy, you know, anatomy is very complicated, right? So you can just go through that anatomy, just revise that as well as your practical classes also. Fine. Okay, so that will come under 30 hours, and additionally, we will be sharing you some videos also. Okay, I'm going to share some videos. So those you are not supposed to study in the live, because whatever we are going to study in live, so the video of the same we are going to share you. Okay, so you can just watch them at your own time. Whenever it is convenient for you, you can watch them. Okay, so in this way we are going to complete 85 hours. Fine. So on your certificate, it will be mentioned for successfully completing 85 hours of prenatal and postnatal yoga teacher training. Fine. Okay. So So before going further, I would like to introduce you to myself. As I already told you, my name is Ruchika Sharan. I am the lead trainer and co-founder of the Om Yoga International. And regarding my yoga specialty, I am ERYT 500. I have been taking 200 hours and 300 hours training courses since more than 15 years. And apart from that, I am a prenatal and postnatal yoga specialist, face yoga specialist, yoga therapist, and also meditation specialist. So I'm certified in all these. Okay, so for your course, I am the lead trainer. Okay, so when we say lead trainer, it means I have completed my 500 hours and pregnancy yoga. Okay, so I have completed my training from various organizations just to enhance my knowledge in that so that we can frame our course in a best possible way. Okay, so whatever course you are going to study, the whole course has been designed by me. And if you have any questions throughout the course, I'm always there for you. You can message me personally. Okay, whenever you have any doubt, or definitely I am going to see you every day in the class. So you can always message me. Fine. Okay. So now let us talk about our course. So as we have discussed, it is 85 hours, 55 hours live training, 30 hours will be the self-paced learning. Okay. So I'll do one thing. I'll just share the PDF. Give me 1 minute. Okay. So 85 hours prenatal and postnatal yoga training. Okay. See, first of all, please understand one thing. When we say prenatal, okay, so the word prenatal does not just mean the antenatal. Okay, so we always use two terms. One is preconception, okay, and other is antenatal. Antenatal means as soon as a lady gets pregnant. Okay, so from the conception till the birth of a baby. Okay, that is known as antenatal. So, whenever we talk about the term prenatal, it covers both the terms. Okay, so in this course, we are not just going to cover the antenatal because normally, whenever we talk about pregnancy yoga, what is the first thing which comes in our mind is okay, asanas for first trimester, what to do in the second trimester, what to do in the third trimester, and labor preparation. That is all. Okay, but more importantly is the preconception care. Okay, see, if you want a banana tree or let us say an orange tree in your garden, okay, having orange is a fruit. Okay, or even when this plant of orange is growing, okay, that is important, or having a good quality of that fruit is more important. Definitely having a good quality of that fruit is important, no? So, how to have a good quality of that fruit? You have to take care before sowing the seed in the soil. Okay, so that seed has to be of good quality. Now imagine the seed is defective and you are expecting a good result. Good result here is a good fruit you are expecting. This is foolishness, no? So same is here also. What is the fruit here? Baby is a fruit. Okay, and for this baby to grow inside the womb of a mother, the seed has to be healthy. What is the seed here? How the seed is formed? From the sperm of a father and the ovum of the female. Okay, so the sperm has to be healthy and the ovum has to be healthy. Now, imagine if sperm is not healthy. Nowadays, you will hear most of the cases where you will see ladies saying they have suffered miscarriage. And whenever this problem of miscarriage comes, who is blamed? Normally, it is a female who is blamed because this is the culture of our society. Okay, but it is not always owing to the female. If the sperm is not healthy, in that case also lady can suffer from miscarriage. So what I need here is that my seed should be healthy. Okay, so that is why the preconception care is very, very important. So, in this course, we are going to focus on preconception care as well. Okay, and along with the preconception, I have designed a separate module for the infertility also. Please always note one thing, because towards the end of the course, when you are going to prepare the assignments, okay, most of the people are confused when they prepare an assignment. They get confused between preconception care and infertility. One is the case a lady is able to conceive. Okay, but she is just preparing herself, she is conditioning her body, she is conditioning her mind so that the seed is healthy. So that is preconception care. But other scenario is where a lady is unable to conceive. Okay, trying regularly for 6 months or 1 year, she is unable to conceive. So that couple we will call as infertile couple. So these are two separate modules. We are not going to mix these modules. Okay, so in this course, we are also going to talk about infertility. So this infertility will be discussed in great detail in the course. We are going to talk about every aspect of infertility. So in that only, I am also going to talk about the complications related with the women's health, like PCOS is very common nowadays, endometriosis. Okay, all these things we are going to talk in detail. Fine. So this comes in the prenatal. After that, we are going to talk about the labor. Labor is another module. Then after that, we have postnatal. Okay, so in a nutshell, we say prenatal and postnatal, but actually there are many modules which will be covered in that. And we will move step by step in the theory part also and even in the practical part also. Fine. Now, who are going to teach you, who are going to be the trainers in this course? Okay, so one is me, Ruchika Sharan. You can see I am the lead trainer. Your next trainer will be Mr. R. Sharan. So he is the founder of Om Yoga International and he deals with breath work and the meditations. So he may take few sessions of meditations and the breathing. Okay. Then we have Dr. Anu Antony. She is Ayurveda doctor from Kerala, okay, residing in Mumbai currently. And she is also Garbh Sanskar specialist. She has done her diploma in Garbh Sanskar. So she is going to take the sessions on Garbh Sanskar. Okay, so we are going to have 5 sessions of Garbh Sanskar. Now, let me clarify one thing more here. When people talk about Garbh Sanskar, they just mean when Garbh Sanskar is said, it is about conditioning the baby, conditioning the fetus inside the womb of the mother. Okay, but if you go in detail of Garbh Sanskar, it is not just that. Garbh Sanskar also talks about the menstrual care. Those of you who are familiar with menstruation is one of the most important aspect in women's life. Okay, see, if you are not getting your menstrual cycle on time, definitely it can also contribute in problems in conceiving. It can contribute in your overall health also. So that is why menstrual care is very, very important. Okay, so you are going to learn menstrual care from the scientific point of view, from yogic point of view, from Ayurvedic point of view also. So from Ayurvedic point of view, Dr. Anu is going to take. Okay, so we call it as Rajaswala Paricharya. I'll just write it. This is a Sanskrit word, Rajaswala Paricharya. Rajaswala is a term used for a lady when she is in her menstrual days. Okay, this is a Sanskrit word which is used. So, knowing the regime for the women when she is in her menstrual cycle, what asanas she can do before her menstrual cycle, after her menstrual cycle, or during the cycle, what practices she can do, what is the diet which she should follow, everything will be discussed in this. Okay, and then after that you are going to talk about she is going to talk about Garbh Sanskar, diet and nutrition in the preconception, in all the 3 trimesters, for the labor. Okay, and after that the next part will be for postnatal. Okay, so always the lady just after delivering the baby, she is known as Sutika. This is a Sanskrit word used, Sutika. Okay, so if a lady has delivered the baby today, from today up to 45 days, normally this is the period for postnatal recovery. Okay, the main crucial time. So that those 45 days, a lady is known as a Sutika. Okay, so all the regime for the Sutika, for the lady after delivering the baby will be also discussed. So that also comes under your Garbh Sanskar only. So you are going to have around 5 sessions of Garbh Sanskar with Dr. Anu. Okay, see, we have designed this Garbh Sanskar. So I don't want to say much, but none of the other center is focusing so much on Garbh Sanskar. They will normally have 1 to 2 sessions of Garbh Sanskar. And this Sutika Paricharya about the postnatal care and the menstrual care, these things I have introduced recently since our last 2 3 batches. Okay, because this menstrual care and postnatal care, I felt it is very important as a prenatal trainer for you to know. Okay, because nowadays most of the ladies, they are suffering because of this. Okay, because especially if I talk in India, we are very hesitant to talk about menstrual cycle in society. Okay, so we keep it something like a secret. And even in the postnatal also, lady is unable to take that much care as much is required by her. So if you are familiar about these things, and as a trainer, if you can spread awareness among the women about the importance of this time, we can definitely help the women's. Okay, so that is the reason I have focused on these topics in a well elaborative way. She is going to guide you nicely about these topics. Okay, so the 5 sessions you are going to have. Then your next trainer will be Priyanki Guliani. She is from Pune. She is residing in Pune, and she has also been taking prenatal yoga classes since many years. Okay, so she is going to take your practical yoga classes. Okay, the complete practical part will be taken by her. Okay, so we had actually 2 trainers, one Priyanki and Shweta Solanki. Okay, so maybe Kavita ji, the videos which you have seen before, so they were taken by Shweta, but recently she has delivered a baby, so that is why she is not available currently. That is the reason Priyanki is taking. Priyanki is a more senior teacher. Okay, so you are going to enjoy the classes with her. She is very nice, very polite speaking. Okay, so you are going to enjoy the classes with her. So you are going to meet these 4 trainers in your classes. Okay, majority of the classes will be taken by me. Okay, Mr. Arsharan, you are going to see him very rare. Okay, because he's just going to take very few sessions of meditations. Dr. Anu, 5 classes. Priyanki is going to take around 15 classes. Okay, so these are going to be your trainers. Now, let us talk about the modules. Okay, before we go for the modules, because most of you are always more curious about the certificate. Okay, so this is the sample copy of the certificate you are going to receive after completing the certificate. Okay, so this certificate is registered from Yoga Alliance USA. Okay, because Om Yoga International is RPYS, registered prenatal yoga school. So after completing the course, you will be eligible to teach to the pregnant ladies or to the women's in whole world, in worldwide. Okay, because this certificate is internationally certified, not just in India, but outside India, in every country. Of course, looking at my previous students who contact me after completing the course, some of the countries have their own regulations, so they ask for few other things also. So from you, if any one of you is teaching in any other part of the country and that country is asking for some specific regulations, you can always contact us. Wherever we can assist you, we are definitely going to help you. Okay, especially Aina. Aina, you are from? Unmute yourself.
I'm from Kazakhstan, but right now I'm living in Abu Dhabi in UAE.
Okay, okay, okay. Yeah, so I guess in Abu Dhabi, Dubai, because some of you are from Dubai, as far as I know. Okay, so there are no specific regulations there. So you will be easily able to teach with this certificate. Okay, yeah. Now, let us talk about the modules we are going to cover in the course. Okay. So, the first part which we are going to study is the pregnancy yoga anatomy. Okay, so we have different modules. As I told you, I have divided the course into various modules. So one of the most important module of the course is anatomy. I know anatomy is very difficult, okay, but I'll try my best to make it easy for you. Okay, but for that, what I need from you is study every day. Whatever we are going to study on the same day, please revise it. If you keep the things in pending, it is going to be difficult for you. Okay, but trust me, you are going to enjoy. Okay, see, of course, we are not here to become the doctors. Okay, so I don't expect from you to remember the anatomical terms. But being a woman, at least I should know about what is happening in my body. Okay, because we all are going through these changes every month. So what are these changes? We all know about PMS, before our menstrual cycle. So we go through so many syndromes, no? What is the meaning of syndrome? Syndrome means when multiple symptoms happen together. Okay, so you know. So what happens in PMS time, premenstrual syndrome? We have indigestion, okay, or some of them will have bloating, mood swings, migraines. Okay, so like that, there are so many problems which are happening all together. So the common word, so one word which is used for in anatomy is syndrome, when multiple symptoms happen together. Okay, that is known as syndrome. Okay, now we should know why these symptoms are there. Why is it happening like this? And you have seen it is different for different ladies. What I go through, you may not go through that, right? So that is why, for that, it is very important to know about your body. Kavita ji, you want to say something?
Well, some person will have pain also, right?
Yes.
So, as you said, it differs from person to person.
Yeah, yeah. So even you will see some ladies will have pain, some ladies will not have even little pain also. Hmm. Sometimes it happens, no, like this is my own experience. So when I was in my teenage, so I didn't had any pains at all. So I never experienced what is pain. So definitely like I used to see around me ladies having a lot of pain in the cycle. So they used to take the injections also. So I was very much surprised that time. But I never had even a little pain also. But now as I am growing, so I could feel that pain sometimes come up. So so that's how it changes, no? So we should understand what it is basically. Okay, so now in this anatomy, what we are going to study, we'll study the anatomy of male reproductive system. So that will be in very very brief. Okay, because male studying male reproductive system is important. Why? For the preconception. Okay, because if there are any complications in the male body, definitely that can also contribute to infertility, no? Okay, or we should know about the sperm health also. So we are going to talk about the various complications related with the sperm. Okay, so just to study that, so in brief we are going to study about the male reproductive system, but female reproductive system we are going to study in great detail. Okay, then we are going to study about anatomy of pelvic floor. Very important concept. Difference in male and female pelvic floor. Okay, we will see how the female body is designed naturally for conception. Okay, and because the female body is designed naturally for conception, we are going to see how the pelvic has been designed based upon that. Okay, and also whenever we talk about the natural, like the normal deliveries or by C-section, how this pelvic plays a role in that, depending on the different shapes of the pelvis. So we'll see that as well. Okay, and how to take care of your pelvis. Okay, it's very important to have a strong pelvic floor. Okay, so all this we will study. Then we are going to study about the menstrual cycle. So in that menstrual cycle, we are going to study about the role of the hormones, how the hormones changes. We are going to talk about the importance of estrogen, progesterone, all these different hormones. Okay, and how they change and what effect they have on our body. Okay, then after that, we will talk about fertilization, implantation. What if a lady conceives? How the changes happen in the body? What if a lady does not conceive? Then what happens? No, because if a lady does not conceive, this will lead to the menstrual cycle. Okay, so then we are going to talk about that and the four phases every month: follicular phase, ovulation phase, luteal phase, menstrual phase. So, all that we are going to study about. Then, what are the practices we should do in every phase? Like if you are in your follicular phase, what practices you should do? During the ovulation phase, what practices? During luteal phase, what practices? Okay, so all that we are going to study in this. Fine. Then after that, we will move now to the antenatal. Okay, because we have finished with the menstrual cycle. Now our main concept is about knowing, okay, the lady has conceived, she is pregnant. So now starts the journey of pregnancy. So we will see the changes which happen in the body during first, second, and third trimester in the women's body, as well as the changes which are happening in the fetus in all the three trimesters, and also what are the yoga practices we can do in each trimester. So in yoga practices, what asanas, what pranayam, what meditations, because there are specific meditations for the pregnancy. Normally, you will see most of the yoga centers, they are teaching very general meditations, yoga nidra, breathing awareness. But here we have designed the specific meditations for the pregnancy, like baby connection meditation, welcoming baby meditation, birth meditation. Okay, so all these meditations we are going to see in each trimester, and in which trimester what meditation has to be taught. Fine. Then after that, we will move to the labor part. So we will talk about the labor physiology, the three stages of the labor, role of hormones during the labor preparation. Okay, of course, you will have a practical session for that as well. Okay, but in the theory, we will talk about the labor physiology and the hormones playing their role in the labor, and based upon that how you have to take care during that time. Then after labor comes postnatal physiology. Okay, so in the postnatal time, what are the changes which happens in the lady's body? Okay, how the changes happen in those 45 days, how she comes back to the normal zone, we'll see that as well. And also about the physiology of breastfeeding. So this breastfeeding part will be taken by Dr. Anu. Okay, so this all we are going to study in anatomy. Okay, it is vast. The syllabus is very vast, but we have to cover it in 30 days. Basically, 22 days we have. Then after that, we have the next module, infertility. I have already told you about the infertility. Okay, what is infertility? What are the types of infertility? Primary infertility, secondary infertility. We'll study infertility while studying the reproductive system. Okay, and what are the complications? How the hormonal changes can contribute to infertility, like PCOS. It is a hormonal problem. Okay, so like that, we will see the causes of infertility. Then the yoga protocol for the infertility. So when we say yoga protocol for the infertility, as I told you, what practices in every phase has to be done. Okay, so what asanas will help. And Dr. Anu will talk about few dietary regimes also, which can help for the male as well as for the female. So she will tell like what are the functional food remedies for the infertility. Consuming that functional food, it can contribute to fertility because we have many herbs which will help in improving the sperm health, which will help in maintaining the hormonal cycle. Okay, so she is going to talk about that in her class. And in my class and Priyanki's class, we are going to talk about from yogic point of view and from the scientific point of view. Fine. Then what meditation, special meditations for the infertility, pranayam, shat karmas, preparing your body for that. No. So that is going to be discussed in the infertility. Garbh Sanskar, I have already told you. Okay, she is going to focus on this prenatal, and what care also along with the diet, what care she has to take in every phase, that will also be covered. Then after that, we have handling the complications during the pregnancy. See, this is again a very important topic. Okay, today only one of the student was asking me about PCOS. PCOS is one of the most important and trending complication nowadays. So we'll study PCOS in detail, endometriosis, and so the complications in before conception, which is contributing to infertility, and the complications during the pregnancy, and the complications after delivering the baby. Okay, so nowadays you must have seen postpartum depression is something which is very common. Diastasis recti is very common. Okay, then diabetes, hypertension, breech baby, anemia, all these problems during the pregnancy. So we'll study about those complications and how we can help them through yoga. We will also see that. Okay, this is another module. Fine. Okay, then after that we have prenatal asanas. Prenatal asanas, pranayam, and meditation asanas for every trimester. Fine. So which asanas? See, asanas are same. Okay, one thing let me tell you here is you are going to be prenatal yoga trainers. So you are not supposed to cram the things here. It is not like you will get everything ready made here. Why? Because every woman's body is different. Every pregnancy responds in a different manner. You agree? Hmm? Yes? So now what you have to see, asanas are same, but how you have to modify these asanas, looking at the need of a lady. Understanding, no? This is what we are going to teach you. Okay, so here your intelligence is also going to be very important. You have to work, understand the things in a smarter way. You have to act in a smarter way. Clear? Okay, so you are going to learn about asanas, labor preparation for the labor, what asanas can be done. Same about pranayam and meditation, I have already told you. Okay, so in labor preparation, what are the breathing techniques? So one of the main technique used is the Lamaze breathing. We are going to learn about that also. Okay, so that comes under your labor and birth preparation. Fine. Then postnatal care, diet in the postnatal, asanas in the postnatal, everything we are going to study in detail. Postnatal also, I have just improvised the topics on postnatal recently. So you are going to study in detail about postnatal because postnatal, is very, very important. Normally, what happens as soon as a lady delivers the baby, the whole family is behind baby's health only. Majority of the times what happened, the women's health, the mother's health is underestimated. Okay, but understand those 45 days, they are very crucial. If she doesn't take care of herself during these 45 days, she is going to suffer in her later life. And this happens. You must have seen it happens. Okay, and nowadays, like not nowadays, this is a trend. See, like in India we have a trend of eating a lot of ghee, clarified butter. Okay, then after that what happens, that pouch comes out, no, saturated fat. Ghee is nothing but a saturated fat. Then after that ladies are complaining of weight gain. Now, see, nowadays, what is happening? Before, ladies used to do a lot of work. Nowadays, people who are aware, ladies who are aware, they will go to gym, they will do yoga, they will maintain their weight. But those who are not aware, they will put on the weight, then they will start blaming motherhood for that. It is because of pregnancy. So, how you can overcome that? Because what happens, especially in C sections, we are eating a lot of fatty diet. Lot of fat is given in the postnatal time, but there is less workout. You are so there is least movement. What will happen? That saturated fat will settle, no? Body needs this, but you are having this much. What will happen to that rest of it? It will settle. Then after that, you do anything. I have heard many ladies saying, we try everything, but this fat does not go. This pouch does not go. So we are going to see how you can overcome that by changing your diet because you need fat, but you need good fat. So we'll see how we can overcome that. Okay, and how to take care of the lady in the postnatal time, because during that time again many hormonal changes are happening in her body, so she needs more care, she needs more attention from the family, from the husband. Okay, so we are going to talk about all this in the postnatal. Then there will be no depression. Hmm? If she is receiving proper care, why she will go into depression? No? See, already it is exerting for her. It is 24 by 7. Na? Postpartum is 24 by 7. So she is physically, mentally exhausted. Now, in that, if she is not getting any support from the family, from the husband, she will enter into depression. Okay, but we have to see how a lady may not go into depression by taking care, and in that, food also plays a very important role. Okay. So this is about postnatal, about breastfeeding, the positions of the breastfeeding, diet for the breastfeeding. Dr. Anu is going to talk about it. Okay. Then our last module, very important module, is teaching methodology and lesson planning. Now you have all the knowledge. Okay, now you are full of knowledge. Now this cup is full of knowledge. Now you have to see how you are going to organize it. Okay, because as teachers, you should know how you are going to organize your lessons, how you are going to give to the people. See, whatever you are going to study in anatomy and philosophy in Dr. Anu's session, you don't require everything in the practical sessions. That is for your knowledge. Okay, that is why TTC. Otherwise, you can join normal regular sessions, pregnancy yoga sessions, you can join and you can teach, but you can't. What is the difference in regular sessions and TTC? In TTCs, you are getting the proper knowledge. So you learn about anatomy, philosophy. So you learn everything. Okay, but in regular sessions, you can learn only asanas, pranayam, and meditations, maybe. Okay, but that cannot make you a teacher. Okay, to be a trainer, you have to be full with knowledge from all the sides. Okay, so now after learning all the things, now how you are going to frame your lessons, how you are going to teach people, right? How you are going to help people, how you will make your own lesson plans, how you are going to help others. So this is what we are going to study in teaching methodology. Okay, this is again very important aspect. This I will be taking and also Priyanki will also be taking this part. Clear? Okay, what all we are going to learn. I don't think I have missed anything in this course. I have tried my best to keep everything in this. Yes, Kakoli, you want to say something?
No.
Okay, so now the timings, as you know, of the course is 2 to 4:30 p.m. Okay, so first you are going to have a practical session. Okay, 2 to 3:15. Then 3:30 to 4:30, you are going to have a session with me. Okay, or either with Dr. Anu. Okay, so on Monday and Friday, because in before starting with the practicals, your base has to be stronger. So Monday and Tuesday, complete session will be taken by Priyanki. So she is going to have one session. So in that, she is going to make a base of her practical. What are the things you have to take care? How a pregnant lady should stand, how she should walk, everything she is going to guide you. And in the practical sessions, what are the things you have to take care overall? She is going to guide about that. Then 1 hour, 15 minutes, she is going to focus on the practical. Okay, so Monday and Tuesday, I am not going to see you. Priyanki is going to be there with you for the whole session. Then on Wednesday and Thursday, you will have 1 hour session with Dr. Anu about Garbh Sanskar. Okay, on Wednesday, she is going to focus on Garbh Sanskar. Thursday, she is going to focus on diet and nutrition. And other 1 hour, 15 minutes, Priyanki is going to have a session with you. From Friday, I am going to continue for 1 hour, and and Priyanki will be there. Okay, so whenever you are going to have a session with Dr. Anu, I am going to inform you beforehand. Okay, so right now you have 2 sessions with Dr. Anu next week on Wednesday and Thursday. Fine. Okay, and all the sessions will be recorded. You are going to receive the recording of every session every day towards the end of the day. So please do not panic. Okay, because we are going to record the like we are going to upload the sessions towards the end of the day, and we are going to upload it on the Google Drive. Okay, so in the Google Drive, we will make one folder RPYT May 26. So in that day 1, day 2, you will see different folders. Day 1, like today is 1st of May, it is orientation session only today. So you will see that session. Okay, give me a minute. I'll just share you because most of you find it difficult to access it also. Just give me a minute. I'll just open my Google Drive and show you. See how you are going to access it. You will open your Google Drive. Okay, so you have to share your mail ID. Okay, so whichever mail ID you are going to share with me, we are going to give you access on that. Okay, so on that email ID, you have to open the Google Drive. So here you will see the folder. See how you have to access it. You will go on shared with me. When you are going to open your Google Drive on the email ID you have shared, you will open it and you will click here shared with me. Okay, so here you can see like Face Yoga Gen 26 has been shared by other mail ID. So you are just going to open and you will see. Okay, and how it will look like. These are our different courses which happened in this year. Like we had this RYT 300. Can you see the different folders? 1st April, 2nd April, 5th March, 6th March, like this. Like similarly, you will see here 1st May, 2nd May, 3rd May, 4th May, like this. Okay. Now, when you open, you can see the different ones. Anatomy. So these are the different classes of our 300 hours. So here you will see practical session. If it is Dr. Anu's session, you will see Garbh Sanskar. If it is my session, anatomy and the topic anatomy of female reproductive system, anatomy of male reproductive system. This is how you are going to access it. Is this clear? Yes? Okay, it is very simple. And this access will remain with you for 1 year. Okay, and yeah, you will also see one folder of manual. See here, manual. Okay, the complete manual will also be shared in this only. Okay, RPYT, the name of your folder will be RPYT May 26. In that, you will have one folder of manual, like here. Okay, just open that manual. Orientation session, you will see like this. Okay, like here also we had an orientation session. 1st May, orientation session. Okay, then from Monday, because we are going to start with the regular classes, so proper. Okay, 4th May, 5th May, complete it will be. Is this clear? Any doubts if you have, please let me know. Yes, any doubt in whatever I have explained? No? Okay, now just one thing is remaining. It is regarding the evaluation. Okay, most of you are worried about the examination, no? Okay, so for the examination, you may have an MCQ test towards the end of the course, multiple choice questions, whatever you have studied. Okay, I will share the sample copy. Before the test, I am going to guide you. Okay, that's all. And you may have a viva test. Okay, see now, before I used to give case studies, but now I am not going to give case studies. Why? Because chat GPT, it is very easy to figure out people are making their assignments from chat gpt. Recently I have seen most of my students making the case study from chat gpt, so actually it doesn't make any sense. Okay, so what is my concern here while giving you assignment? I just want you to be confident. Okay, and and I want to be sure that yes, you are prepared now. But if you are using chat gpt to make the assignments, why to waste the time? No, what I want is you should use your own mind. Okay, so that is why from this batch onwards, actually, this happened in my 300 hours batch, the recent batch which we completed, and also pregnancy batch also. So people are making it in the chat GPT. So from this batch onwards, no assignments. We are just going to have a Viva test. I am going to ask you few questions to from everyone, and that's it. Okay, maybe we are not even going to have MCQ also. I will decide towards the end. MCQ, I decide looking at the performance of the batch. Okay, so as of now, please do not worry about the examination. Just focus on your course because here you are supposed to learn. Okay, the purpose of examination is just to make sure you are well versed with all the concepts. That's all. And you remain serious. Otherwise people take the things for granted, and that I don't want. Okay, because this is a very serious concern. When we talk about the pregnancy, no, it is very very crucial, very sensitive. You have to be very careful while teaching yoga to the pregnant ladies. You cannot take things very simple. Okay, of course I don't want you to be tensed also. Fine, but at the same time you do not have to be so free also. Fine. Yes, Ekta.
So I agree with the chat GPT thing, but for our self-assessment, like, can you still give us assignment, like,
Yeah,
not
yeah,
and not
sure. Sure. I will share that case study.
case? Yeah, that would be great. Thank you.
Yeah, see, others also, if you wish to make, most welcome. You can even share your assignments with me later. So I'm always there to help you out in that. But I would appreciate if you make at your own, because Chat GPT is not going to help you. See what content you are preparing from your own understanding, that can never match Chat GPT. Of course, Chat GPT is giving very nice content, huh? But still, please don't use Chat GPT. Okay, just if you want to finish the language, you can definitely use Chat GPT, but let it be your own understanding initially. Okay, so I will definitely share the case study. Anything else? So clear about the assessment also, no? And as soon as we finish with the Viva, you will get your certificates.
Ma'am, Saturday is off, right? No.
Yes. Yeah. Saturdays, Sundays will be off. Regular classes are from Monday to Friday. And the Zoom link which has been shared to you today will not be valid in the other classes. For the other classes, I am going to share you another Zoom link. And all the information related to the course will be shared in our common group. So please, even
And
if you want
certificate will get hard copy or soft copy.
soft copy. See, even if some of you are not able to join the live classes someday, no, please stay in touch with the group, because all the information I have seen people, some of the people are not joining the live classes and they don't even check the messages on the group. Okay, so every update will be shared in the group. And use the group only for the course related messages. If you have any personal questions, please message me personally. Okay, so the message, so the number on like on which you were contacting currently, that is our official number. So there you will see our staff contacting with you. If you have anything related with the course, you can message me personally. I will share my number. Okay, today I messaged also. Please join. That is my personal number. Anything else regarding the course if you want to ask? No? Let us have a quick introduction. I'll just stop the recording.
Excuse me. Will you have for last our exam? I mean about we'll do with pregnant woman. We should to do with pregnant woman
No,
like
no,
practice.
nothing. No, nothing
No
like
need.
that.
Yes.
No.
Thank you.
Yeah, how we are going to have a pregnant women here? That's not possible. Sometimes we used to have the pregnant women's also in the course. Sometimes it happens. Normally it happens in every batch, but I don't think in this batch we have any pregnant lady. Okay, so yeah, even in your practical classes also you can use some props. Yeah, one thing I forgot to tell you. Thank you for reminding me this. You need props for your practical classes. Okay, especially you need yoga blocks and strap. Okay, cushions we all have at home. See, if you are planning to make career in yoga, no, you can even buy a cushion also. Yoga cushions come. Okay, so they look more professional. Fine. And sometimes even gym ball is required. Okay, but I won't say you to buy a gym ball. Okay, those of you who want to make it as a career, because gym ball is required for the labor preparation. But yoga blocks and strap is something which is very common. Okay, so I would request you to buy that if you don't have. Okay, so in place of yoga strap, if you are not willing to buy, you can use a dupatta also. But if planning to make a career, please buy the belt. Buy a proper yoga strap. Okay, because there are buckles also, no? So if you want to tighten or loosen, no? So that is why buy that. And yoga blocks. Yoga blocks, if you want to buy Wise Life, very nice brand. Wise Life, no? You will get it on Amazon. Let me write on the chat box, Wise Life. They have good quality.
Excuse me, ma'am.
Yes.
Yoga strap, is there any size that we need to look for?
Let me just tell you. I will just specify the exact size. Huh? Yes,
Excuse me,
Archana.
ma'am.
Yes.
Can you please share the picture or any link for
I
just
will.
to
I
get
will.
an idea what
I
to
will.
buy?
Yeah, I will.
You can
I
share
will.
it in the group, ma'am.
Thank
So
you.
Yeah. Of course, I'll share it in the group itself. Let me just talk to the Priyanki if she's using the gym ball. If in future you are planning to make it as a career, you can even buy the gym ball also. Let me just consult with her. Because Shweta never used to use the gym ball. So Priyanki may be using because she is taking the classes for the pregnant ladies.
Ma'am, blocks should be soft or hard.
See, they should have a like what not soft, not hard. You can use the foam blocks. Foam blocks will be better. Wise Life normally gives foam blocks. Normally we use cork blocks also. Okay, but cork ones are they will start withering away after some time. So it's better to use the foam blocks. Yeah, that's all. Okay, so yoga blocks. And also, in order to have a better experience, you can use a belly also. during your practical sessions. Okay, for the belly, you can just use a small cushion in your belly. Okay, that Priyanki is going to guide you. So you don't need to buy the belly. Of course, bellies come in the chemist shop also. You can buy them, but you don't need to buy it. You can just manage it from the home. Okay, Priyanki will guide you about that. And today, just after finishing our class, okay, please message me your mail IDs. And please use one mail ID because we are going to give you access on one mail ID. Okay. If you have any other question, please ask me. Okay, let us have your introduction.